I'd like to tell you about the moment I began to question my decision to become a doctor. I was speaking with Rebecca Merrill, a leadership coach who works with doctors at some of the most prestigious hospitals, Stanford, Duke, Yale, and the like. These are the doctors who have made it to the top. But they were emotionally exhausted, detached, even cynical. They were burned out. And here's the thing. When Rebecca would ask them, "So why do you do what you do?" most of them couldn't give an answer. This is alarming. I'm part of a generation of future doctors who began clinical training as COVID emerged. After years of sleepless nights studying, praying we'd get into, never mind a dream school, any med school will do, we did. And we thought we'd finally made it. And then we watched as doctors and nurses left the profession in droves. Even as we slowly recover from the pandemic, we face the worst epidemic of physician burnout in history. Most American doctors report symptoms of burnout, and 1 in 4 plans to quit entirely. 1 in 4. What's more, while we know that burnout and a lack of purpose are correlated, it's still surprising to me that 1 in 3 doctors say they find no meaning in their work. What is happening? If even the most accomplished doctors are struggling with burnout and a loss of meaning, what hope is there for the rest of us? Look, there's no denying the massive systemic issues contributing to burnout, the hours upon hours spent on documentation and fighting insurance companies, the misaligned financial incentives that force doctors to see more and more patients each day. The system must change. But is there anything the individual doctor can do on a day-to-day level to rediscover meaning in medicine? And can a stronger grasp onto this meaning guard against burnout? Last year, I set out to answer this question. Together with Stanford oncologist Tyler Johnson, I created a podcast called The Doctor's Art to explore what makes medicine meaningful. And after 70+ hours of conversation with some of the most thoughtful people in medicine, from young nurses and residents, all the way up to the presidents of Doctors Without Borders and the National Academy of Medicine, I'm here to tell you the most important insight I've distilled from all the wisdom and stories they shared. And it's this: people aren't machines, and doctors aren't mechanics. There's something transcendental, even spiritual, about caring for another human being. That's what makes medicine meaningful, and that's what's missing in medicine today. I think on some level, we all know this, even as many scientists and doctors are rolling their eyes at the word spiritual. I get it, but let me explain. There are 2 distinct ways of viewing medicine. If you see disease as the breakdown of purely physiologic processes, then medicine is an exercise in managing the machine that is the human body with the right medications, ventilator settings, surgical procedures, and the rest of it. Then, when the machine moves past repair, you have nothing left to do. This is the physician as a mechanic. The second way to view medicine recognizes that patients are more than machines, more than a collection of organs working together. And so medicine it has to address the humanity in each patient beyond what can be palpated, observed, measured, and recorded. The patient's hopes and fears, his relationships with those he loves, the values that make life worth living. This is the physician as a healer. For example, when I interviewed Stanford ICU Dr. Adjoa Boateng, I expected her to talk about the chaos of the ICU, where patients are hooked up to machines that literally take over their heart, lungs, and kidneys, where every patient is on the brink of death, and doctors go to drastic lengths to pull back those who go over. When I asked her to share a meaningful moment from her work, that's what I thought she'd talk about: the intensity the extremes, the heroics of saving a life. Instead, this is what she said in her own words. There was a patient who passed away in our ICU about 8 months ago who was quite young. I could see the inner battle, the inner turmoil of having to say goodbye to his young children, but also the full awareness that his disease was not going to be survivable. In his final hours, the hospital room felt almost like a church. He asked us to play music that he liked, so we put music on. His wife asked us to light candles, so we did. The chaplain was there. He had family photos. And as we gathered around him, I silently cried in the background because it was all so moving. I will never forget. As he gasped his final breaths, his wife's repeated whispers of, "I'll see you on the other side. I'll see you on the other side." To Dr. Boateng, creating this beautiful, this sacred space epitomizes what makes medicine meaningful. And it had nothing to do with fighting disease or prolonging life. The doctor wasn't a mechanic. The doctor was a healer. And you might think, sure, that sounds lovely, but there's no way the average doctor would have the time to create this so-called sacred space with their patients, right? I agree. But in talking to so many doctors who have found deep joy and fulfillment in their work, I'm convinced it's not how much time you have, but how you use it that matters. So here are 3 ways that we can create that sacred connection between the doctor and the patient and reclaim meaning in medicine. Number 1, get closer to the patient. I mean this in a literal, physical way. When I asked Victoria Sweet, a hospital physician at UCSF, for her top advice to students and residents, she said simply, sit down with the patient. It sounds plain enough, but when I thought about it, I realized how rare I see this in practice. During rounds in the hospital, you're more likely to see teams of doctors swarming around a patient's bed, towering over and talking down at the patient. Sometimes we don't even go in the room. We just pop our heads in through the door and eyeball the patient. Even in clinic, where the doctor usually is sitting down, it's often not with the patient, but in a corner, tending to the computer. I was skeptical of the simplicity to Dr. Sweet's suggestion, but the next time I was in the hospital, I decided to try it. I was assigned to care for a middle-aged woman with chronic pneumonia. I'll call her Sarah. The first time I went to see her, I realized I couldn't sit with her because the hospital room literally didn't have a chair. So instead, I knelt down by the head of the bed. She sat up a little bit higher. Our eyes were now level. As I began my self-introduction, I felt my tone grow warmer. Her features softened. In that space and time, we were wholly present with each other. When she voiced, amid wheezes, her frustration at the worsening of her lungs, I took her hand and told her that whatever happened, we'd be here every step of the way. Over the course of her 5-day hospitalization, I didn't do anything for her that I wouldn't have for any other patient. But on the day of her discharge, when I met her in the hallway, she tapped the nurse who was pushing her wheelchair and said, "If I ever must be here again, I'd like him on my team. He sees me." And that's the power of getting closer. The second way to restore meaning is this. Be curious about the patient. Ask them about the things in their lives beyond what's happening in the hospital room. When I interviewed Wes Ely, an ICU doctor at Vanderbilt, he told me that when he first meets a patient, he always asks about 4 things: their favorite food, favorite music, pets, and hobbies, because this forces him to see the patient as fully human. Over the course of my rotations, I've noticed how easy it is to reduce patients to their conditions, both in my head and when I'm talking to my team. We say, the hepatitis guy in room 35B, the stroke up on unit E2, the kidney tumor kid in room 9. It's efficient, I suppose, but when you drain medicine of the warmth and the humanistic richness that comes from seeing the patient as a person, patient care becomes something rote, at peril of tedium. Once I was working in the eye clinic. Nearly all my patients had diabetic retinopathy, a complication of diabetes where blood vessels in the eye are damaged. It sounds bad, and it can be, but the examination and treatment are quite algorithmic. I remember thinking, okay, 30 patients back to back, all with the same condition. Just follow the standard screening and treatment protocols, like clockwork. Then halfway through the day, I met Alice. She had been drawing in a sketchbook when I entered the room, so as I examined her eye, I said, "Looks like you enjoy art." She immediately replied, "Well, I'm a painter. It's everything to me." "May I see some of your work?" She pulled out her phone and showed me a series of lush oil paintings depicting the Bay Area coastline. In that moment, everything changed. I realized I'm not just saving an eye. I'm preserving a woman's identity, her ability to do the thing that brings her joy and purpose. I was reinvigorated. Each patient encounter was now a chance for me to discover why what I'm doing matters. And that's the power of curiosity. The third way to restore meaning is also the most radical, and it's this: embrace the ineffable. Ineffable. It's not really a common word. By ineffable, I'm talking about the mysterious aspects of the human experience that transcend logical comprehension, yet resonate in all of us. This means bringing notions like love, mercy, courage, sorrow, dignity, and the human soul back into medicine. Anyone who has ever worked in medicine will recognize how countercultural these words are. Why? It's the exact opposite of how we're trained as doctors. Since our college years, we are conditioned to believe that success in the hard sciences is what counts. In medical school and residency, we learn to perform physical exams, interpret lab values, generate diagnoses, and apply treatment protocols. It's quantitative and empirical. It's the doctor as a mechanic. This work is essential and challenging, absolutely. But it's also the more comfortable stuff. Because while there are standardized, evidence-based guidelines for diagnosing a patient with colon cancer, there is no guideline for addressing matters of hope and faith and fear when you tell a patient they have only a short time to live. And so we avoid it. We tell ourselves it's not within our domain. We seek shelter in survival charts and clinical trial data, intellectualizing a patient's existential crisis as if it can be reduced to hard numbers. But my interviews have shown me that the most fulfilled doctors are the most fulfilled because they embrace the ineffable. Soumya Swaminathan is former chief scientist at the World Health Organization and a pediatrician who treats kids with tuberculosis and HIV. When I asked her where she finds strength despite the suffering she witnesses, she described the often long and brutal treatment regimens involved. And the love that these kids develop for her as she accompanies them on this journey. Opening herself to this love is how she finds strength and how she honors the resilient spirit of her young patients. I can't count the number of times doctors I've interviewed have mentioned how they can better love their patients. Not just help their patients or make them feel better, but love their patients. I was taking care of this patient in the hospital once. I'll call him John. John was getting ready for a gallbladder surgery. He was quite nervous. I knew the surgery was quite safe, but didn't really know how to comfort him. Then I saw a Bible on his bed and decided to ask about it. Many of my patients tell me that their faith is important to them. Is that true for you as well? He eyed me cautiously, but then confirmed that he was a Seventh-day Adventist. Against everything the unwritten curriculum had taught me, I decided to ask, how may I best support you through your faith? He was taken aback, but then thought about it, then quietly suggested that a prayer might help. Then he closed his eyes, granting me a needed pause because I wasn't sure I knew any Christian prayers on the top of my mind. So I quickly pull out my phone, Google Christian prayer. Then I hold the phone behind his pillow, hoping that even if he opened his eyes, he wouldn't see me reading. Then I began. The Lord is my shepherd. I shall not want. He makes me lie down in green pastures. He leads me beside still waters. The whole psalm took no more than 40 seconds. But when John opened his eyes, his breathing was slower, his body untensed. This was exactly what he needed in that moment. As the technicians came to take him to surgery, he squeezed my hand and, with a smile, said, "See you when I'm done." And that's the power of embracing the ineffable. Don't get me wrong, these ideas were at first alien and unnatural to me, much as they might sound to you. I didn't even know if I was allowed to think about loving my patients or create a space that could be described as anything close to sacred. But I've noticed that the willingness to probe these heartfelt intricacies of the human condition is like building a muscle for making meaning. The more I try to nurture presence, curiosity, and an appetite for the ineffable with my patients, the more confident I become as a healer. This is something we can get better at. And the connections I develop with patients makes each day at the hospital worth it. And if the greatest medical minds I've had the fortune to speak with are to be believed, this is just about the most powerful antidote to burnout there is. Medicine offers meaning precisely because confronting illness and mortality drills down to the questions that have occupied mystics and philosophers for millennia. Who are we? What does a good life look like? What are we to make of a world that effuses suffering, yes, yet bursts with beauty? Humanity's best attempts to answer these questions fill shelves worth of books. They are the stuff of scripture, temples, and prayers. I don't pretend to know the answers. But my experiences and the stories I've heard through my conversations have convinced me of this fundamental truth. Doctoring and the act of caring for another person cannot be divorced from the quest to answer the soul's deepest questions. Because whether you are a doctor or parent or a mentor or friend or colleague. Forgetting this truth threatens to render prosaic even our most cherished relationships. But when we remember that life, at its essence, is comprised of elements that are inscrutably mysterious and sweet, that memory can imbue our interactions with something very much like love, we fill medicine and life with meaning once again. Thank you.